Hello, I'm reviewing the article Asking Questions, the Effect of a Brief Intervention in Community Health Centers on Patient Activation. The authors are Darwin Dean, Wei-Sin Liu, Dan Rothstein, and Martha R. Gold. The article can be found on West Texas A&M University's library website at www.wtamu.edu/library. This article relates to healthcare as providers and patients need to communicate in a healthcare setting. This reading reviews how to get patients to ask better questions to their healthcare providers. Participants in this study were asked multiple questions while in the waiting room to prepare them to ask questions to their provider. The participants were asked to describe a decision they had recently made. Then they were asked to describe a decision that they had made in a healthcare setting. Ultimately, the patients were followed down a path to brainstorm questions to ask their provider that were either open or close-ended questions. They were then asked to prioritize these questions and refer to the list of questions during their visit. Overall, this study was very sound in the methodologies and the principles. The results in the writing were great. However, the limited data sets could impact these results. Only 5 community healthcare centers in New York City were used in this study. 86% of the respondents were female, and 90% of the respondents were either Hispanic or African American. I believe that if they expand this study into different cities and different states, add some more male respondents, and add a mixture of different races, they would have better feedback to overall see if this is a great study and a good course of action to use in other healthcare settings across the country. So now that you understand the results a little bit better, let's ask some questions. If you were to expand this research, where might you consider looking to expand? How might the limited data sets impact the results of this study? What questions would you consider asking in place or in addition to the questions the researchers asked the participants? How might you implement this type of study into practice in a healthcare setting in your local community? Also, what would you change if you had to do this study in the future? In conclusion, patients could be prepped to ask better questions, which could result in a better two-way communication between patients and providers. While providers are not fully responsible for patient and provider communication, they can set the stage to make communication easier to their patients in a healthcare setting.